All right. Look at you go. Look at you go. All right, there's our Twitch. There's our restream. Hey, good morning, everybody. Bear with me a moment here while I get all of our different platforms up. With a tab open to monitor the chat and stuffs. Oh, look at that, man. Periscope is quick with it today. Sometimes with a long delay there. Let's go over to D Live as well. Good morning, everybody on D Live. Good morning, everybody on Twitch, Periscope, Facebook, YouTube. I fucking forget.
Let's make a list.
Make a list. Check it twice.
No.
Gonna find out how not glorious your bitch ass is. There we go. Aha. All right, man. I had to sign in on the Goobs.
Really?
Yeah. What the fuck? What the fuck?
Sweater on.
Oh, here, I can close the window if you want to, you know. Hey, make some coffee, too. Make some coffee while I go over the news. And then come back in here and talk to me about it, okay?
Okay.
All right, thank you. Thank you, Jenny. Thank you, Jenny. All right, good morning, everybody. We're going to get right into some fucking news this morning with the plants as the backdrop. They're doing really fucking good. So what we're actually doing today is week 3 discussion and breaking down some news. Where does that begin at for us? Right there. Right there. All right. So first, I'm going to roll a fucking joint. Jesus fucking Christ. I need a joint. I've been awake for like too many minutes without a joint. Cannabis, I do start and end my day with cannabis. I do. As well as continue it through the, I smoke a lot of weed, I'm trying to tell you. Trying to be upfront about it. I smoke a lot of fucking weed. I'm going to smoke some weed here. Un momento. Actually, man, let's scrape up this wax here. Uptown, funk you up. So we might play a little music for you here. I don't like playing music on my streams. I mean, I do, but it's other people's work and creations. You should have permission to use it before you use it. All right. So, welcome everyone. Welcome up to my show. And good morning, Tire Lightpool user, IVLW, Billel 045. Hey, what's up, everybody over on Periscope? Good morning. We're seeing how this works in the morning. It works pretty good, well in the evening, but it seems like you guys over on Periscope are not around as much in the evening. So that being our new favorite platform to stream to, we are talking to you this morning. So we're trying this out in the morning, just kind of see how things go, and maybe you guys want to spend your morning with us and learn about some weed news and check out some awesome plants. Our plants are doing fucking really good, man. I'm really impressed with them. Like, those are week 3 veg. So no kidding, man. Those are little seedlings that we took out of solo cups and put them in here 3 weeks ago. And bam, they are fucking doing good. And you know, we had a little stunting in the beginning too. There are some towards the back there that were stunted, didn't do anything for about a week, and then they moved, and now they're doing really well. So they're a little smaller though. They're like a week behind. So we're gonna have some varying size ones. We think we're gonna go about 6 weeks with this veg. Jay Bruce 24, what's up, brother? We're gonna go with about a 6-week veg on these girls, and then we're gonna go into flower. So I think if these girls have 3 more weeks to go. I mean, they get real vigorous, especially near the end of veg to the very vigorous growth. So well, that's our plan going forward. We'll see how it works. Jenny, you smoking down with me or what? I know, but I need to know if I need to wait for you. Oh, you should though. I have to talk her into it every day because she's a lot nicer when she smokes. So I'll be sprinkling that shit in her food, like, hey, how you feel now, Jenny? No, I'm just kidding. Don't Bill Cosby anybody's food out there, please. Not my advice. Don't pull the Huxtable Shuffle on anyone. It's not right. It's not right. Oh, so let's get right into some news. I'm hanging out on Periscope mostly today. There we go. It's a Periscope type day. But let's get into a little bit of news, man. So here, I don't need to hear your talking head bullshit. So this is a story out of Denver from CBS 4. A state lawmaker is taking up the fight for a Douglas County teenager whose school district, he says, is discriminating against him. Senator Chris Holbert shared Ben Wan's story on the Senate floor. Ben Wan, that's a cool name. Like, are you a player? No, man, I've been one, and now I'm not. The teen has epilepsy. Mr. Wan, Ben Wan, has epilepsy. If he has a seizure, the only drug that can save his life is a cannabis-based nasal spray. Amber Wan, Ben's mother, says she couldn't get to her son's school, Mountain Vista High School, in time, and says he's deathly allergic to the medicine in ambulances. The family begged the Douglas County School Board to let volunteers at the school keep and administer the nasal spray. It refused. In desperation, the family sued the district for discrimination. Their response was that Ben hasn't proven that he has a disability. Just because they say no, the need doesn't go away. So we keep fighting, Juan said. Holbert is joining them in their fight. It just makes no sense that a school board would effectively decide which student could live and which could die. Well, I think that's a little oversimplifying, taking it to the extreme. That's fucking lawyer talk. Current law allows parents, caregivers, or school volunteers to administer cannabis-based treatment at school if the school district approves it. Holbert plans to sponsor a bill that would make approval mandatory, not optional, in cases like Ben's. Why put his life at risk just to store this nasal spray in a locked box or desk or something? And if he has a grand mal seizure, someone run and get it, and instead of injecting with epinephrine, that would kill him. Use this. It's not hard, Holbert says. Ben is hopeful the bill will pass. I feel like something good is going to happen. Do you, Mr. Wan? Douglas County School District wouldn't comment on Ben's case. To be clear, according to its policy emailed to CBS 4, the district allows parents and caregivers to administer medical marijuana, but not school employees, because it's still, fuck you. Fuck you and your federal fucking law and your federal fucking government too. God, that pisses me off. Just pisses me off. Due to 85-year-old politics, this little bastard has to die. Like, does it make any fucking sense whatsoever? It's like, someone need to get rich there on the paper and oil industry there, so fuck you and you sick children. Like, who makes those? I don't know. I don't care. You know what? I don't care. I don't fucking care. This is going to be a negative fucking, a negative toned fucking stream. If I keep reading about that shit, it's just awful that there are, you know how many people suffer and need those similar types of products in states that don't have any law at all. So it's like, I get your suffering there, Mr. Wan, I get it. But there are people in these other places that are suffering even more. They can't change school districts and get their weed at school. They can't have their mom bring them some weed at school. They don't have any access at all. So where you may have to change schools, there are some people who need this stuff that would have to change states to get it. So I get your plight. I get your, come over and smoke with me.
I'm gonna sit right here so I don't get the babies.
But I can't hear you over there because your voice sucks. Because it's so tiny.
I can talk louder. I know how to talk louder. Okay?
It's still tiny. You just sound like you're bitching.
No,
It's like, who has that tiny voice and is bitching?
I'm not bitching.
I know, but it sounded like. For the record, she was bitching a little bit there. But yeah, and it really pisses me off of this federal government bullshit. I even wonder, like, what the fuck do we even need them for anymore? What do they pay for? Food stamps, universities, and unfair prosecutions. I can't fucking see anything. I can't see any other benefit that we get from being part of this union anymore. I really don't care if we lived in the free state of Michigan. I would think I'd be happier. Because you're not free. When you're in it, when you live under a government that tells you heroin is safer than cannabis, and tells you, fuck you, your kid's just gonna die if he has a seizure at school. I don't know, is that a government or is that a fucking dictator? I mean, is that democracy or is that tyranny? I don't, it doesn't fit with anything that the founding fathers had in mind for this country. It doesn't fit with my morals and my values for my children, my family, and my neighbors in this country. So I posit to you, do we even need the federal government anymore? I mean, Washington's a fucking sham. We got a game show host running the whole fucking show into the ground in Washington. It's like, what? If a game show host can buy the presidency, why should any of us care anymore? I don't think we should. Jenny, that's a question.
I don't do politics.
I don't do politics either. Politics would be like one side or the other. There is no, I don't care, Republican, Democrat, Independent, who the fuck you are. There is no doubt about that hey, Finn Swim, thank you for joining us. There is no doubt about the fact that we have a game show host president in the White House who's barely literate, who doesn't understand how money works, who wanted to print money print money to pay the national debt, and the kicker, he grabs women by the pussy. Right by the pussy and brags about it. The pussy gripper. If the pussy gripper can buy the fucking White House, why do any of us care? Why should we care? Why should we listen when an FDA tells us heroin is safer than weed? So that to keep medication out of our hands so that we have to buy it from Pfizer, who they got investments in. Why should we care? That's my question. We shouldn't. And the answer is, we shouldn't. We shouldn't care. Hey, I got 5 hearts. Holy fuck, man. Thank you, guys.
I don't know what 5 hearts means.
I don't either, but I imagine it's good. I think it's good. Right? I think it's good.
There's the Endgame toys. We just got that one yesterday.
Oh, guess who's watching on Twitch?
Huh.
Only me and you. Guess who's watching on Periscope? All kinds of people.
It's weird.
Yeah, you get larger audiences on Periscope and Twitch. Or Twitter. I like Twitch. Don't get me wrong. I do like Twitch. I don't want to.
Nobody's up this early on Twitch.
No, the Twitchers are a late night crowd, man. Whoops, wrong one. I didn't want to do that. I didn't want to do that there, Jenny.
Can you reach the ball? Can you reach the ball?
Yeah, there we are. All right. And we are on the Twitter, Twitch2. All right, so let's go over some more news for everybody here on that's hanging out with us.
Is there any happy news?
Let's find some happy news. I doubt it, but no, I'm just kidding. That's sad to say that. I doubt there's any happy news. Here's some fucking happy news right here. This is an article I'll direct your attention to. Well, first I want to smoke this one. It is Seth Rogen.
Oh.
Made out of weed buds. Seth Rogen and Evan Goldberg's weed brand is not only beautiful, but also committed to social justice. And I read an article about, I know where this article's going. I read about this topic the other day. Okay. It's been 9 months since Canadian actor, writer, producer, and director Seth Rogen co-founded his cannabis brand, Houseplant, with his childhood friend and Pineapple Express creator and screenwriter Evan Goldberg. Launched in April of last year in partnership with corporate giant Canopy Growth Corporation, the Toronto-based business has managed to leave their mark by offering a variety of high-quality sativa, indica, and hybrid strains, all sold in well-designed, colorful packages. It's the colorful packaging that wins them. The company has been growing steadily since during 2019, and its not just their product rollout that's caught the fans' attention. The comedian recently told Forbes, that's where I read that, was in Forbes. The comedian recently told Forbes Houseplant is immensely focused on providing an elevated and educational experience that's easy to grasp, which is why the brand is stepping up to the table in matters of social equality and cannabis legalization in the United States. That is very incomplete. What he's talking about, here, let me go to the entire article. What he's talking about is a program that Seth Rogen is. Okay, here we go. The new National Expungement Week. Okay, so fighting the good fight. In September, Rogen showed his support for the National Expungement Week, abbreviated NEW, initiative by pointing out the injustice behind cannabis-related convictions and how criminal records resulting from minor offenses can and should be expunged. The event campaign that ran throughout the U.S. was designed to provide legal relief and expungement of criminal records to 77 million Americans who suffer from the consequences of these each year. Restriction to housing, employment, education, and voting rights are just some of the issues prevalent here. So that is new, everybody. NEW, the National Expungement Week, and it is this week. This year it's in September. I think it was in September. Hey, 714 Rican, what's up? I think it's in September again this year, and they clear people's records who have minor nonviolent cannabis crime and currently live in, or not nonviolent minor cannabis crime conviction and live in a state where it's now legal. A lot of people don't know, and this is one part that was in the other article that I read that wasn't in this one. A lot of people don't know they're available for it. They're eligible for expungement. That if you, hey, 2020 Vishun, what's up, my man or lady? If you live in a state that has legalized on especially recreational cannabis, then and even in medical states too. But I know especially in recreational ones. Richard, Florida. Hey, what's up, Richard? You are in most cases eligible for record expungement if you have a minor or nonviolent cannabis conviction on your record. Now there are some people, in some states that spend their entire lives as a convicted felon because they got caught with a bag of weed in their pocket in the 70s. And I'm not advocating breaking the law, but we all know what's happened here with cannabis. It's medication. It's should be taken as a daily dietary supplement by every adult on earth, and it's been kept from us through 85 years of horrible politics that have demonized it in an effort for the financial and political gain of a few, and that's why cannabis has been kept from us. I don't know where I was going with that. Oh yeah, that it's awful fucking thing. We have 85 years of prosecution and we have inequality in the way that cannabis law is enforced. And I'll just say it. I'll just go ahead and say it. I have been let go by, and I shouldn't say that. I should not go ahead. I've been let go by police officers for things that people of color that I know have went to jail for. And it is selective enforcement. And I don't know that my skin color was the reason. I mean, I always treat officers with respect and tell them the truth. And maybe that's why they let me go. Where, someone that tries to hide from them and is afraid of them and takes a different approach may go to jail. I don't know. I can't say why. But I've been caught with weed plenty of times. And I've never went to jail for it. And I've got black friends that, convicted felons walking around convicts have to write all that shit on every application they fill out. Yeah, I'm a convicted felon because they got caught with the same fucking size bag of weed I got caught with many a times. So it is fucked up the way that it's enforced. The fact that it's illegal to begin with, the fact that for political gain, political and financial gain of a few, vital medication was kept out of the hands of everybody. And it's awful. It's awful. Federal prohibition is awful, and it doesn't look like it's going anywhere anytime soon. And it gives these assholes this fallback. These people who are just discriminating against you because they don't like the smell of your fucking medication will fall back on, well, it's federally legal. Well, he's still a federal criminal. He's a federal outlaw. And that just, that makes me, it's like we're using the word dealer. You know, I supply 5 patients with their medication and grow it for them. And some people will call me a fucking weed dealer. And oh my God, that sends me to the roof, man, to the roof immediately. I mean, drug dealers are predatory by nature. They're not helping anybody. They're not doing anything for anyone. They're taking your money. Oh, we got a straight cold. Thank you for the host. My man, thank you. I think he's hosting us over on Twitch, but it showed up in my feed. Oh yeah, because I've got a yo, what's up? What's up, Colt? I was over on Periscope, man. I didn't see you're over here. Hey Jenny, you know what I was just thinking?
What?
Where the fuck is my coffee? I'm gonna get slapped today. Watch.
I can't over there because he doesn't allow me to.
Oh, Hanny cries when you come over. Well, make me a cup of coffee and sit right there and use your big girl voice. And people can still hear you. Can you hear Jenny? Can anyone hear Jenny?
You don't like when I make your coffee.
Yeah, I do. Just make it good.
If I get it the way I like it, you're
No,
not
put less cream than what you put in it. And here's my patient now. Hey, Colleen, good morning. How's everything going? Oh, no problem, dear. That's what I do. Yes, I do, actually. Okay, that would really help me out, actually. It's about what I have left of it. Oh, 40. No problem. Yeah. What time were you thinking?
All right, boys. Jackson, be nice.
Okay. Well, whatever time works for you. This morning, I guess. This morning would probably be better for us. Well, I'm doing a live stream right now. Let's say, you want to do 11:30? Cool. That gives me time to finish up with my folks here. And all right, cool. And you wanted what we talked about of the GMO, right? Okay, all right, sounds good, sweetie. Well, I'll give you a text and let you know that I'm leaving. Hey, you're welcome, Colleen. I'll see you soon. Yeah, bye-bye.
He was asking what strains we got there, but I don't. I know the 2 that we got from Josh, but I don't.
Oh, who was asking? Somewhere on Twitch?
Yeah, cool.
Oh, okay. Well, answer him.
Well, I was going to, but
we have got Rainbow Chip, Melanado.
But different strains of them.
Yeah, well, we got like Rainbow Chip 1, 3, and 6, Melanado like 1, 8, and 5, and then we have Larry Perps, Blue Dream, and that's it, right?
Do we have a Mandarin cookie? I think maybe.
We could have a Mandarin cookie. We had a label snafu. Hey, Journeyman36, want to become famous? Buy followers. Buy followers.
Followingbot.com.
Yeah, I'm all good on buying followers, man. That just sounds shady as fuck.
You gotta buy followers.
That don't sound right at all, man. That does not sound like the way it's intended to be, man.
I think we have Mandarin cookies in there.
We might have a Mandarin cookies. I had Mandarin cookies. I had some, yeah, for sure. Once Mansky's around, Mansky will come bouncing motherfuckers out for me. He's the best fucking mod. He likes bouncing people out. He likes bouncing them out, so it's funny. He'll come get those motherfuckers.
Off of him.
But
Jackson.
Yeah, I might have Mandarin cookies. I had a labeling snafu, so I had to label a couple like X1, X2 because I didn't know what the fuck they were, and then it turned out one of my explants got their label ripped off. It's like the labels fall off. I got to get a better labeling system. So I had an explant.
Like OJ.
It was either X1 or X2. X1 was definitely Mandarin cookies, so I might have a Mandarin cookies in there, or another Blue Dream. I might have 2 Blue Dreams or Mandarin cookies. But I'm really excited about the Rainbow Chip and the Melanado. Their Rainbow Chip is made, its parents both first place cup winners. Melanado, its parents both first place cup winners. And Melanade itself, which is a different variation of Melanado, first place cup winners. So there's a lot of award-winning genetics involved in the room that you see behind you there. And my Larry Perps, I mean, just unfucking believable, man. At 30.8% THC on my Larry Perps the last time I had a test on it. And that's the little bush that's front and center, the little bush, the lighter green bush, Larry Perps. The darker green, taller one there, Rainbow Chip. Hey, Ajajadam. Hello, Ajajadam. Welcome to the stream, man. Thanks for your support.
Don't throw your cup.
Jenny.
Coffee.
Yeah.
I'm trying to
Mug. Go about this far from the top of the mug with coffee, and then creamers.
Colt wants some of those genetics.
Where you at, Colt? Where do you live? Because we do specials, man, for our audience. Where do you live, Colt? Because we do specials for our audience. I can seed some. That would take a couple months. I can get you clones like right away, man. But it just depends on where you're at.
No, what'd you say with the coffee again? 'Cause I'm watching the kids because Jack's trying to
About this far from the top with coffee, and then fill it up with creamer, and then mix it. Oh, Georgia, no. I wish, Colt. There's no way that'd be illegal. Totally illegal. If you came here and got them, I think I could transfer the clones and seeds to you, but yeah, I don't. Yeah, you'd have to drive the clones back. I mean, I could give you seeds if you were here, but I couldn't mail them anywhere in the U.S. It's strange. Like companies can mail them from out of the country to you, but I can't mail them to you from Michigan. I violate my Michigan medical cannabis law and a federal law. So I can't, man. I wish I could. But if you were here, I could definitely hook you up with some seeds. You're over 21 and whatever. We can work that out, but I can't do anything illegal. No, I got the little kids now. So I'm like, yeah, they keep me from the dark side. I must stay away from the dark side. These little shits expect me to feed and clothe them like all the way through college, so I can't do that from prison, Colt. So I gotta refrain from the dark side.
I did exactly what you said, but
hey, that looks nice. That looks a little milky.
I did what you said. Actually, I think I put more coffee in it than.
That's perfect, Jenny. Thank you so much. Thank you so much for the cup of coffee.
He's trying to play wrestling with his brother, and it's not working out well because he's not old enough to wrestle.
Hi, 589-57072. Hello, and welcome to the live stream. I'm having some can of coffee this morning. That's what I call it, can of coffee. And you can have it multiple ways. You can get some sweet cream, like Italian sweet cream, and infuse that. Which is basically putting it in a butter brewer with some bubble hash and brewing it, and infusing the bubble hash, the trichomes from the bubble hash into the creamer, and then it's heated up and activated, decarboxylated in the butter maker. Then you can put it back into its container, put it in the fridge, and medicate your coffee that way. I am a fucking old school flower smoker, so I prefer to have my can of coffee with a lit joint in one hand and a big mug of coffee in the other. But the two substances go very, very well together. They complement each other very well.
Jason. Alright, that's it. You don't get blanket anymore. No. I told you how many times. Brother's not a toy. I'm not a toy. I look like a toy, but I'm not a toy.
I heard that I'll be happy when I'm able to get off the dark side. Yeah, I know. It's strange. Like they can mail them to you from out of the country, and like even seed banks in the country, do some of them anyway. Will like say you order them from Denver, Denver will send them to Ireland, and Ireland will send them to you. For some reason, it coming international is it's not a violation of the laws in Colorado for doing it that way. But by sending it to another state in the union, it's like some kind of fucking bullshit, you know. Wow, 6 ounces a week. Yeah, that's a lot, man. You know, I might. Well, we can talk. We can talk off camera, Colt. We know each other in IRL. We can talk, you know, off camera. Mine vary. I've got 5 patients, and sadly, I'll say I just lost one.
Clients. Okay, there's that one client. Like, whoa, I didn't know anyone smoked more weed than you.
Yeah, right. 6 ounces for one person's a lot. But we just lost a patient, unexpectedly too. She's an older patient and had heart troubles, but she was so active. I just saw her the week before, and you know, she's getting all of her Christmas shit and around her house and fixing her house all up. And then it was, I think the night before New Year's, she left this world and passed on for something better.
No, don't mess with mom's hair. Go play with your brother. He's getting jealous.
And we will miss her dearly. But a patient who took her place on my patient load smokes considerably more than she does. So now my whole requirements have changed, you know, because now I have this other person's needs, and his needs are a lot greater than what her needs were. So mine goes back and forth depending on how my patients are doing, and as they come and go. And when my patients go, it's usually to heaven because we take care of a lot of older Americans, the older generation. And next year, I think the population in our country is expected to be 20% senior citizen. And I see that. There's a lot of, I get a lot of seniors that call my service and inquire about getting a caregiver. Hey, Saloon 56. Hey, thanks for hanging out with us. And I get a lot of calls from senior citizens who want to try it. The doctors have recommended it. Our products got 2 of our patients off opiates, one off of Vicodin, and the other one was finally able to put Suboxone down, who she'd been on Suboxone coming off opiates for a long time. And both of them is with a glycerin-based tincture that I make for them. And done. They put it down. They don't. They use that tincture, about 4 bottles of it a month for one lady, and the other one about 5. And that's it. No more opiates. So we're pretty proud of that. We think it's an achievement of cannabis therapy that. And some anecdotal, you know, evidence that it can be pretty effective in the treatment of opioid addiction and chronic pain.
That's some rough stuff, huh?
I do also have a gentleman who, yeah, for sure, I am too, Cole. And I tell him all the time, like, I can certainly grow you cheaper stuff and get you cheaper stuff, but if you want that cheaper stuff, it's out there. You go get it. But I don't have it. I can't help you with that. I can't verify that, you know, the therapeutic value of garbage weed and shit with seeds and stems in it and brown weed, and I can't tell you what's in that. 22% of the street weed that the DEA used to, the DEA confiscates, used to be 22% of it, 22 or 23% of it, test positive for PCP. So you never know what you're getting with that shit, and there's no way I could offer that as medication to an elderly person, not even knowing myself what's in it. So yeah, I'm a quality guy too. But yeah, my requirements for my patients change as their patients change. Oh yeah, that was getting into this story, and I almost missed it. I'm glad I do that. I do that sometimes. I have a patient who's an alcoholic, a really bad alcoholic. I mean, lost his family to alcoholism when they left him, lost his career, his driver's license is permanently gone. It's really, really bad alcoholism, and he uses our uh, products. He's my designated patient, and he uses. I supply him with weed. I just guess I can just say it if he's my designated patient to help him fight alcoholism. And I gotta say, for what I've seen it do with opioids and chronic pain, I have not yet seen that result in alcoholism. This gentleman struggles still. I mean, he'll come over and get his stuff, and he'll be ready to go. He's gonna quit, and he's done, and he thanks us all for helping him. And it was one time I came home and he was just sitting on my front porch, and I was like, "Hey man, what's going on?" And he was like, you didn't answer because I was out, and then I didn't hear the phone. He said, you didn't answer, and it was either go to the party store and get some liquor or come over here and wait for you. So I just came over and waited for you. And I was like, wow, and he got his stuff, but then he'll still call me in the middle of the night drunk, so he's still struggling. He's still doing the best he can. And we're going to do everything we can to help him, but I didn't see that immediate benefit and relief like I did with these older ladies. Oh my God. And that brings me to my newest patient. I've got to tell you guys about her. She is fucking cool. 23 to 25 is really good shit, man. I've hit 30.8 once, but consistently between 20 and 27, in there, just depending. But that's some really good shit. I mean, a lot of weed that we smoked growing up was like 11, 10%. 20%. People don't understand. Like they hear these numbers thrown around a lot, like 20% THC, and some of it is mislabeled, and some people don't know what they're talking about. But 20% THC is some really, really potent cannabis. Some really good stuff. But yeah, I went over to help this old lady, and she was so funny. She was so nervous. Like she wanted tincture. I gave her some tincture, and she called me back about a month later and said she wanted some more. And then I didn't. She wanted the same thing I gave her last time. I thought she wanted dry flower. I forgot that I had gave her tincture. So I get over to her house, and she's like, well, no, I wanted the tincture. She said, I don't smoke or anything. And then I was like, okay, I'll run back home and get it. And she said, well, what's the difference? And I started to explain to her the different routes and how one works a little faster, but the tincture may work a little longer, but the inhaled route might seem a little more psychoactive to you than the oral route, and just going over the ins and outs, the differences. And she says, well, you know what? I'll try it. This is a 72-year-old lady. She says, I'll try it. How do you smoke it? And I was explaining to her about pipes and papers, and I said, well, just hang on. Let me run up to the tobacco store, and I'll buy you a little pipe, and I'll buy you a pack of papers, and I'll bring them back to you. Just give them to you. And she was like, okay. She's very nervous about it. She's like nervous, and you can see like that she's anxious, and her speech is kind of stuttering a little bit because she's, very nervous about doing all this. Her husband wasn't home, so it was just me and her. So, I showed her, had her get a plate and a pair of scissors, and I showed her how to cut up a little bit of weed and stuck it in the bowl, and I showed her how to hit it. And it took her a minute to realize, to figure out how to use the carburetor hole. But the first hit this lady took, the very first one, it was a small one. And she said to me, oh, wow, that is stronger. And I said, yeah, the inhaled route is a little stronger, and you're going to notice it. And then I took a hit off the bowl, gave it back to her. And by this time, she watched me close. Now she has it. Now she's got it down. So she takes a big hit. I mean, a big one. And she blew it out. And you could see the weight lift off this lady. The anxiety left her face. She took a big, deep breath. She went from this little, and then she starts talking. She went from, in 2 hits, she went from little scared like nervous, anxious, elderly lady with a strange man from the internet in her house to laughing and telling me stories about her grandkids in 2 hits. It was really nice to see it at work that way. You know, to see that how the type of benefit that our older population is getting from it. And I told her then, I was like, you know, we could make the coolest video for the internet right now. And I asked her, and she said no. She said that it's not a big secret. She said all my friends and family know that I use it. She said, but they've never seen me use it, so I don't want to use it for the internet. And I'm like, okay. I'm still telling everyone about it. But yeah, she's a really cool lady, and it's nice to see it in action, you know. Dogpound 511. I hope you're a Browns fan like me. I'm a huge Browns fan. Welcome, Dogpound 511. But yeah, so it's nice to see it in action like that. When you see old ladies are able to put opiates down and are able to live in and not be in pain and not have to take dope and you know, it's really good thing to see, you know, to see your work in action, to see the benefit that you're having for some people. And that's what drives me forward in this industry, man. My entire life, I've never been able to keep a job where I wasn't helping people. I mean, I had the same job at the same hospital for like 15 years, and I got hired there when I was 19 or 20. But I had plenty of jobs before that, from like 13 to 19. I worked the whole time I was in school. And I always went through job after job, man, until I found a job helping people. And I left that job helping people for this job helping people, because this job seemed like a whole lot more fun. And I got to say it is. It is. So let's get into another story then. Thank you, Seth Rogen and Evan Goldberg, for your fucking awesome weed brand and your commitment to social justice and the furtherment of social equality for everyone in the cannabis industry. It is you are an example to follow, sir, and I will do my best to live up to that example. Thank you very much. Oh shit, I went back to the wrong, let me go over here. Canopy Growth Corp, there we go. There we go. So, we just talked about nasal sprays. Let's stay on nasal sprays, and let's talk about this one. This is an article over on maryjane.com. Mary with an E, maryjane.com. As in Happy Jane, that also smokes weed. Probably happy because she smokes weed. All right. Let me light my joint back up. I had a run in my mouth. The world's first magic mushroom nasal spray is here. The world's first psilocybin magic mushroom nasal spray has been developed. Welcome to the future, or the shroom boom, to quote the spray's creators. A spore-to-door psychedelic therapy company out of Oregon called Silo Wellness is behind the latest innovation in psychedelic consumption. The vertically integrated company claims its nasal spray users see the benefit of psilocybin with a faster onset time. The product is also unique in its ability to deliver a consistent metered microdose with each spray. Our research is focusing on uptake speed and bioavailability at this point, although data is also being collected regarding efficacy. Silo Wellness founder Mike Arnold told MaryJane.com, according to the company's research, some bioavailability of psilocybin is lost through digestion in the gut, which is avoided by going directly through the nasal membranes. In other words, when inhaled in vapor form, psilocybin is absorbed into your bloodstream through your nasal membranes and not through the liver and stomach. We were just talking about that with our last story about the tincture and and my friend who I was trying to explain to her how it worked differently, but because of the route. One is avoiding the gut, and one is getting directly into the bloodstream. So very similar to what we were just talking about. Taking a traditional oral dose of psilocybin often induces nausea. It is technically a poison, after all. Additionally, consuming psilocybin orally has a relatively long onset time, too, within 30 to 60 minutes, while peaking takes place within 2 to 3 hours. The nasal spray's effect, however, is said to be felt within minutes and without the complications of an upset stomach. So this is a psilocybin nasal spray, and the only reason that you're going to hear us talk about that here, or we're going to bring that up here, get into that and discuss that here, is because of the FDA's recent designation of psilocybin. The FDA has recently designated psilocybin as a breakthrough therapy drug, meaning that they already have clinical evidence of its effectiveness for major depressive disorder and anxiety disorder in cases where no other drug has worked. So it's now designated a breakthrough therapy, and one company has been given the contract to fast track the research on it. So the FDA has fast-tracked research on psilocybin to be used in anxiety, PTSD, and major depressive disorder in cases where other drugs have failed to work. So we're talking a lot more about it now. But what I would like to say, I'd like to further the discussion about psilocybin, and that's one of the reasons that I bring it up here. Is to further the discussion about it, but I have to be very, very clear that it remains illegal everywhere in the United States except for Denver. Not even in the entire state of Colorado, in the city of Denver. There may be other municipalities but I've not heard of them. I'll do a little research on that. I probably should have done that before I even brought it up. I'll see if there are where psilocybin has been decriminalized or legalized in the country, and I'll put a list up for everyone. But as of right now, the only place I know of is Denver. And if you were to get caught with psilocybin and anywhere but Denver, I believe like cannabis, of course, it's a Schedule 1, I'm pretty sure. So the police, you can't expect any favors or consideration from the police if they catch you with it. You're gonna go to jail. So yeah, it's there, and we're learning about it, and the FDA has fast tracked the research, but that doesn't mean we can go out and buy shrooms off the corner and in the inner cities. You know what I'm saying? You follow the law, do things the right way, and you won't get in trouble. But at the same time, I don't live with major depressive disorder. I don't live with post-traumatic stress disorder. I don't live with anxiety disorder. But I know I'm very close to somebody who does. And I think if he could get relief. Hey, Charlie Marseille? Charlie Marseille. I think I'm probably hacking that up. But welcome to the stream in any case. But yeah, if you live with those things and they affect your life in the way that I've seen them affect this person's life, you probably would take that chance and to get the kind of relief you get out of it. Now, the other thing I'll say about psilocybin is that when it's used for anxiety and depression and major depressive disorder, it's used as an adjunct to psychotherapy. So it's taking mushrooms in a clinical setting with a psychologist. It's not just tripping out in your basement and expecting all of your problems to go away. So it's something that has to be used under professional supervision as well. But the good news is it's working. It's working for people. And I've used psilocybin when I was a teenager. And I haven't since then. But my personality is it's almost depression and anxiety proof. And I don't know, I can't really attribute that to psilocybin. I never have up until I read this recent article about, hey, that Juan Julio, what's up, man? Welcome. Except for that one, when I read that article about it being designated a breakthrough therapy and the FDA has clinical evidence of its effectiveness for those things. And my personality is Like it's impossible. Not that it's impossible. I'm sure it is impossible, but I seem like a natural walking antidepressant. I don't. It's like contrary to everything about me and anxiety. I don't really get anxious about shit or depressed about shit. I don't know. I used mushrooms when I was a kid. We had happy for good fun times. I definitely wouldn't advocate for any kid to use it, but I'm just telling you my experience. This is what I did, and I was a knucklehead, but I did it. And today I'm anxiety proof. I don't know. Maybe I'm just a happy fella anyway, but it's. I wonder if there's a correlation. The FDA is definitely saying that there's a correlation. So you never know. You never know. We got to keep our mind open to everything. Okay. Um, okay. Um. So check it out, man. Keep up to date on the psilocybin research that's out there. And with that, we are approaching. We're a little shy of the 1 hour mark, and we wanted to keep it right around there. So we're going to say goodbye, and we are definitely going to be back on, pop on sometime today, and then with a regularly scheduled show tonight at 10:30. And just hang out. We're going to get some work done. We're going to do some feeding tonight, some defoliating tonight. I may introduce stakes. I've got one tall girl we might start some low stress training on. And some other grow room related stuff. So come check back with us often. Give us a like, a follow. Really appreciate it. We'll be here. And until next time, which will be later today, keep smoking and stay out of trouble. That should be our sign off. Keep smoking and stay out of trouble. We'll see you next time. All right, guys, we'll hang out here.